Hello everyone, so in this video I want to talk a little bit about how to handle clients that have outside plans, like if they're part of the federal retiree program, they have Tricare, they have VA. Now, contrary to maybe what a lot of people say to do, is they don't have to join a Medicare Advantage plan if they don't want to. They have Medicare Parts A and B, and Medicare Parts A and B will cover, and it's like they pretty much have like a supplement plan, right? If they would like to join a Medicare Advantage plan in order to, let's say, take advantage of a network hospital, or a lot of folks who have to go like in the Florida communities where the Advantage plan is like governing the living area that they're in, then they got to join the plan, and that's okay. But how does it work then if they join a Medicare Advantage plan, like many people do? That's a PPO plan, and it's supposed to work in kind of tandem, coordination of benefits. Well, it works exactly like if they just had Medicare Parts A and B, except instead of Medicare Part A and B being their insurance guidance, that primary insurance company that is taking care of their approvals or disapprovals of services, what will happen is simply that insurance company, the Medicare Advantage plan, will be the one determining whether or not their coverage is acceptable or meets their medical guidelines for the insurance company. And then, same thing like if they have a federal plan or Tricare or VA, those plans will pick it up right after, the normal or the first Medicare Advantage plan picks up their portion of it, and then it'll just kind of fall in line like it normally does. So what happens afterwards is the same process as what happened before they join the Medicare Advantage plan. Is now whether or not the primary payer, which is the Medicare Advantage plan, will be covering the services that they require. And that's where it gets kind of sticky, because Medicare Advantage plans are infamous for denying care and all this extra stuff like that. So that's where your client is going to have to be kind of aware that, well, yes, the Medicare Advantage plans may have some bells and whistles. Is it really worth their, the freedom and flexibility? Some people might say, of course it is. I mean, all my doctors are in network. The insurance company will approve most of everything that I've done so far. Why not save some money by enrolling in a zero PPO, getting some gym memberships, getting some free dental, and if that's the case, then that's good for them. But make sure they understand that their primary insurance company is no longer Medicare Part A and B. It is the new Part C plan that they signed up for. Additionally, some things like a mail order doesn't work for Tricare if you are on a Medicare Advantage plan that has a Part D drug benefit. And that's why there are some Medicare plans that are MA only, mean they don't have a drug benefit. But then again, that plan is going to be for a small group of folks who are on Tricare or who have VA benefits that cover 100% of their medications. Remember, if someone has a need for Part D drug coverage, then you're going to have to sign them up for a Part C plan that has Part D drug coverage if you're telling them to forego federal benefits, for example, or Tricare benefits, or if their VA benefits aren't sufficiently taking care of their needs now. So with that said, it's not impossible, it's not something you should not do, but it's something that you should be aware, and you should educate your clients on the true impact of enrolling in a Medicare Advantage plan instead of keeping their original Part A and B benefits if they do have secondary or third coverage like Tricare and federal health insurance plans for retirees. Right? Hopefully that helps. You guys have a great rest of the day. Do good things, and I'll see you in the next video.